Spinal decompression. This is a non-invasive treatment option to help your disc heal. All right, so we have basically a number of different injuries that can happen for a disc and causing what we call stenosis, which is pressure on either the spinal cord or the exiting nerve roots of the spine. Okay, so you can have a disc bulge, disc injuries, disc herniation, or complete degeneration. We can see a disc bulge here, putting pressure on the nerves, and that would cause something called sciatica, which is pain going all the way down your leg. When we do spinal disc decompression, we're basically trying to reestablish the pump mechanism. The pump mechanism is essential to understand because it's what keeps a disc healthy. Now, we have a lumbar spine disc here, and it's made up about 86% water and some other collagen types of materials, okay? And the way that it stays healthy is that we're walking on planet Earth. It does this maneuver, up and down. We call this the pump mechanism. You can think of it as like a sponge. If I had that on a counter and I pushed down and there's water in it, it would kind of squish out. And when I let my hand off it, the water would come back in, right? And so what happens when we're doing this in daily life, it's going to suck the water, the nutrients, and the oxygen back into the disc so that it remains healthy and it can feed the cells, okay? What happens to some patients is that the disc pump mechanism breaks down. So it means that the disc starts dehydrating and it becomes more prone to injury, which causes either bulges or herniations, and way far on, a lot of disc degeneration. That's a very narrowing of between the vertebrae themselves. When we reestablish the disc pump mechanism, we're harnessing in people above and below where the disc is, and then we can actually do some traction of the spine, and we call this decompression. Traction is where it's static, and that would be like hanging upside down on an inversion table, but we're doing it in a mechanical sense of doing this. We get the disc healthier, it rehydrates, we're getting more nutrients, oxygen into the disc itself, making it much healthier. What this essentially does is it's going to give more room for the nerves to live and breathe. If we can create more room, even if there is a little bit of arthritis, a little bit of thickening ligaments that are in here that cause some of that stenosis as well, you'll be much happier.